I'm just going to talk a little bit about a project that I've done, online groups for young people with cystic fibrosis. And this was conducted over the summer holidays and a bit after school time. So that did affect it because obviously we're working in their homes. So sometimes they were away on holiday and things like that. So that's an adjustment we had to make. Yeah, so should we have the next slide, please? So I have pictures in this and they were all shared with consent from the young people. So I'll just give you a bit of information about the group. They were offered 8 sessions, which were weekly at 4:30 on Tuesday evenings. So it was sort of an accessible time for them before, after school, once they got back into school term. Quite a few of them had already participated in a previous group. So some of them had been to up to 16 sessions by the time they finished. There were about 6 regular participants who came to every session. They ranged between 7 and 12 and a mix of boys and girls. The average age was about 8. They were all mainly around 8, 9. And they were all under the care of the Great North Children's Hospital in Newcastle. And so the reason that it was offered as an online art therapy was that current guidelines for cystic fibrosis mean that children with this condition can't meet in person. So for infection control reasons, they aren't going to be able to physically be in the same space as another child with cystic fibrosis. And that means that often they've not met another child with cystic fibrosis. And this is quite unique compared to other conditions where they might see other children in waiting rooms or in treatment facilities, and they might see older children, younger children as well. But also that the Great North Children's Hospital covers a very large area. So it goes right up to the Scottish borders. Some of them were over in Cumbria, around Carlisle, and a few were down in North Yorkshire. So to come to Newcastle, they often travelled for up to 2 hours anyway for treatment. So to get them to come weekly to a session would have been quite difficult as well. And here I've got a image that one of the young people did, which was about seeing other children with cystic fibrosis, and she's put a giant tree between her and the other child to sort of represent how they don't get to connect with each other. They don't see each other past this giant tree. Okay, so have the next slide. Right, so I'll just quickly go through some adjustments that I made personally for online working that I found worked for me. So I've done quite a few online sessions since the start of 2020. So I found that I had to be more active, more directive, almost to compensate for that not being in the room, and also to make sure that all the children had a chance to participate, because I think in a physical session, you'd maybe get more children who would talk openly, might talk to each other. They might notice each other's artwork as well. And you don't get that with the online, sessions. So that is something that's missing. And that meant that I had to be a little bit more directive, a bit more encouraging. So setting up opportunities for everyone to have a chance to show their artwork, to have a chance to talk. Also, to be a bit more, I had to be quite savvy with the Zoom technology, because I think compared to adults as well, lots of these young people were connecting to the sessions on their parents' technology. So they might be on a computer or an iPad that belongs to a parent and they aren't really familiar with it. So there was a lot of adjustments made for that as well. So there might have been things that we could have done online with using iPads to draw with and creating more interactive sessions, but some of those children couldn't engage with that just because they weren't as comfortable with that technology. Yeah, so part of the group was that they made goals, and their goals were to spend time with other kids with CF and to have fun and feel better about ourselves. So with that in mind, I would create a themed activity that we would start with. So the structure of the session would be a warm up and a greeting, and then a themed activity, and then some time to make their own artwork, and then an ending, and we'd have reviews in between. So what I mean by the ending, so soft ending as well, that was another adjustment for art therapy online, is that it's quite abrupt an ending. When you're online, you click leave and then you leave, and that's a big difference from in person, where there's that time when you're clearing up, people are putting their coats on, they're leaving the room, and it's all a bit more, it's an easier transition. And also to bear in mind that they're going back directly into their house, so they're turning off their technology and leaving the session, and then just going straight back into their family life. And we've created a space where they've opened up, they've talked about some difficult thoughts and feelings, and there needs to be a transitional space there where they can readjust back into their life. So this was one of the soft endings that we did. So this is some monsters, and each child had a chance to describe a monster, and we all drew it and saw if we could draw the same monster. So they would say something like, my monster has feathers and a beak and tentacles and 2 eyes, and everyone would try and draw the same thing. And it also helped a lot with group communications. That was something else that I was very interested in with this. So trying to encourage them to communicate with each other. Can we have the next slide, please? Thank you. So one thing that I noted early in sessions was the group were only communicating via or with me. And in response to the group goals, I wanted to create opportunities for interaction as if they were in the room together. So that was one of the themes, that we wanted to create a sense that they could connect, they could talk to each other, and that they would have that feeling of being in the room together. So one group member reflected that it was amazing to spend time with other young people with cystic fibrosis. And in response to this, we started to create a story. So what I'm going to do is just quickly show you their story that they made. So their story was called The Girl, the Bear, and the Unicorn. And this is the girl. And each group member would draw as they made their story together. And we're really looking at collaborative working. So in order to negotiate this story, there had to be a lot of collaboration, a lot of discussion over what was going to happen, what things were going to look like. And afterwards, once they'd finished their story, one of the things was that they all felt like they were together. They could be together within this story. So that blending of a physical and a non-physical space was created through this story making, this art making, where in this world, this imagined world, they could all be together and interact. So I'll just start the story and you can have a listen, and we'll look at the pictures as well. So the girl wakes up in her pajamas with a blanket wrapped around her. She's a little bit scared and confused. Have the next slide, please. Okay. She looks around and sees that she's in a beautiful meadow. Suddenly, a unicorn appears and tells her that she's special and shows her around. So we can have that's the meadow. That was one of the young people's images of a meadow, and then we've got an image of the unicorn as well. There are other children in the meadow, and they all become friends. Okay, have the next slide, please. The unicorn teaches the group to walk across rainbows to travel around. It shows them that they have invisible wings that will help them. Suddenly, a huge, scary bear charges across the meadow. They're very frightened and they run onto a rainbow to get away. We've got our bear there that was made by one of our young people, and a painting of what it looks like when you travel across a rainbow as well. Have the next slide, please. The bear tries to follow, but his paws fall through the rainbow and he falls and cries. I'm not a scary bear. He looks so sad the group feel really sorry for him and go back. He says he doesn't mean to scare them, and the group teach him about his invisible wings. When he finds his wings, he's so happy they become visible, and they're huge and beautiful. So you can see the bear with his multicolored feathery wings as well. Okay, the next slide. The children have to leave the meadow. They're sad as they like to play and chat there, but they know that they have their wings and can visit the meadow to feel together whenever they want. This is a group portrait that one of our participants made, and each colour and shape represents one of the group members, and she's written, "We are all together," and she's got one that says CF, one, she's turned into a dog and an elephant, and she used this to create this image of a group portrait, really, where they were all joined and connected. And from then on, really, so that was the end of their story. And from then on, we sort of had sessions that took place in that meadow space. So we would start the session by just imagining the meadow and thinking about what colours they could see and who else was there. So we would name the other group members. And it was really to encourage that feeling of, we are together. We're not physically together, but we're entering into this shared imaginary space. And then they might create artworks in that space. So as if we're sitting in a meadow together and we're making artworks together. And that really sort of replaced something that felt like it was missing online. And as the group were so keen to create these connections with each other, actually having that imagined space that everyone could share in helped to facilitate that, I think. Okay, yeah. Next slide, please. Okay. So in the final session, the young people made a flower from the meadow to take away with them. They reflected on their story and shared that they saw themes of unexpectedness, with one girl stating, "No one expects to be sick when they're a kid, and in our story, unexpected things happen as well." The other theme was connection, so having a space together. And they identified that the bear showed that sometimes things seem scarier than they really are, and that it's really sad to be left behind. And that was one of the main things that actually the young people brought up, was that feeling of being left behind, of not being able to do things that other people could do, or plans for the future as well, because they were all reaching an age around 10 where the medical staff are quite clear with them about what their outlook will be with their condition, what they can expect in the future. This is when they start to have those quite difficult conversations, and they identified that maybe that was something that the bear felt because he was left behind and he couldn't go on the rainbow with the rest of them. And the final one was finding out that you have wings all along, and that sometimes they're invisible, so you don't know how strong or special you are. And this theme carried on in quite a few of the artworks that they made. So they would make self-portraits, and sometimes they'd have wings and sometimes they wouldn't. And they would talk about how they didn't know that they had these wings, and perhaps they could do more than they thought they could. And I think as well, some of the feedback was that seeing what other children were doing. So we had group members who did gymnastics, and there was a boy who did rock climbing, and a girl who was really heavily involved in Highland dancing. And some of the other group members seeing what they can do made them think, well, maybe I can do more things as well. And those sorts of things, it's different. I think the feedback was that it was different actually seeing another young person and them saying what their experience was and what they can do, compared to medical staff or their parents saying that they could do it. They're actually meeting someone who has the same condition as them and seeing what they can do as well. yeah, so I wondered if we'd like to go back and look at some of the images in more depth, because I know I went through them quite quickly, if that's possible. So yeah, so we had a range of materials sent out to them. So each child got a art pack. So you can see that there's quite a lot of different materials used. So we have oil pastels here, and this was created by one of the girls. And this was her character. So she wanted to be the main character in the story. And then the other children drew their own characters, but for the sake of the narrative, she was the main character. Go on to the next one. Yeah, so this one was the image of the meadow was created with a with watercolors and pencil. What you can almost see is that this young person, she drew around her hand, so you can see it almost looks like a mitten. So then the idea of having that meadow that she could hold, it was a space that she was holding, that she had in her hand, and adding all the colors that she could see. So actually in that, the meadow that we went back to was quite useful for entering into that therapeutic space where we had that time where we'd do some breathing exercises and we would see what the meadow was like this week, whether it was raining, whether there were new colours, what was going on in the meadow. And that was a nice entrance into the sessions as well. And then we've got the unicorn. This one was made using pens as well. So the unicorns really became this idea of something to guide you as well through the sessions. Have the next one. So this one was created using paint as well, and lots of sort of splashes of colour, and this idea of transitioning through each other. So yeah, so moving around together, and then there's the bear as well. So the way we ended up with the story was from one of my themes. So I prompted them not to create a story, but to imagine a space where we could all be together. And really, the story developed quite naturally from there. So they would each draw something, and there would be a lot of participation in terms of talking. So this really moved us away from the young people talking to me and then me replying back to the group. So sometimes someone would say, can I share what I want to do? And they'd be directed to me. So instead, they would be talking to each other. So it would be, while we're in the meadow, what if this happened? What if that happened? I've drawn this. What do you think of it? And it shifted from it being a focus on me and then the participants to them really feeling like a group, and they were taking this together and moving the story forwards without any prompting from me. Yeah. Okay. We're having the next one. Yeah. So we've got watercolors here and the bear with his wings as well. And I think this image of rainbows as well is something that we see a lot in the hospital. And there's lots of images of rainbows around, the idea of transitioning and something that's beautiful that comes out of rain. So that was a theme that they used a lot in this. Okay. And the feedback from the group was that, again, it was mainly about, it was amazing meeting other young people who had similar conditions. One young man said, I feel better about myself than I used to because I felt like I was all alone. And another boy in the group said, it was really great to meet other people who had the same thing as me, and we could talk about what we were doing together. Yeah, so actually I've run a little bit faster than I thought I was going to. So if we go on, so the again, because it was only that 8 sessions, creating that flower they could take away with them was a bit like creating, you know, a sort of transitional object that they could take away, because it was quite a short intervention, and we would hope to maybe do a bit more in the future. And several of them have now gone on to one-to-one art therapy as well. So there is that option for these young people as well. Okay. So thank you, everyone. Sorry, I went a little bit fast there. So if anyone wants to ask any questions or see anything else, that's...
Thank you, Megan. That is
Thank you.
just amazing. I'm really glad we've got time for questions, actually. So I know Anya is still in the room as well. So we'll wait just to see Anya pop up. There she is. Thank you. Thank you both very much, because that is really insightful. You know, seeing the research that you have, and then seeing an example of what can come out of an online group. There was a couple of questions around the assessment for art therapy. So around whether, you know, as you said, Anya, it's not something that everybody is suited to, and just thinking about what do you need to think about, what sort of thing would you be looking for when you're doing an assessment of whether, and how easy is that to do when it's group, and also that you're doing that often online as well. So I don't know, Anya, if you've got any thoughts.
Yeah, I feel that the assessment definitely requires, you know, quite a lot of attention anyway, whether it's in face-to-face or online situation, but definitely online situations create additional concerns, just things that both therapists and clients need to be aware of. I think what really I found in the survey from art therapists was that their primary concern was the safety of clients. Obviously, in case of young clients that you work with, this is even more so, because their safety depends not only on their relationship with the therapist, but also on how parents or guardians are involved in their therapy process. So I think in terms of creating safe spaces, you know, therapists often found, at least from what they had shared with me, was that they appreciated additional time and opportunities for to meet their clients prior to starting the sessions, almost like scheduling dedicated time online, really just dedicated to making sure that we are all okay in this space, that the space is actually safe. There's obviously, you know, at least 2 physical spaces if it's one-to-one therapy, or many more spaces if it's a group therapy. So it's very important to tune this all in, and I guess this additional time required for preparation was something that I came across from therapists' experience, and something that they found they actually needed, and they needed this out with of the session time. So perhaps one tip like this.
Yeah,
Brilliant.
I think I found that similar as well. So I for each client who came and joined the group, we had a sort of online session beforehand, and it was usually with a parent, where I would talk to them about what kind of space they need, how to look after their artwork, how to keep it safe afterwards, and yeah, really make sure that that's in place before they joined the group. Also, another thing I think is that there were young people who were referred and that this team thought would really benefit from art therapy, but you're relying on their parents and on them either having a good internet connection or good technology, or also you know, if they've got quite a chaotic home life, that might mean that they would really benefit from some art therapy support, but it also means that that's going to be quite difficult for them to keep a schedule and to get online at the right time. And often those were young people who didn't end up engaging. Yeah.
Great, thank you very much. There's also a question around, sorry, I'll just go to it. Thinking about the soft endings you mentioned, Megan, is there a way for parents, carers and families involved in making that transition easier, and sort of what type of conversation you're having with parents in that assessment about what that might look and feel like for children?
Yeah, I think making it clear that, you know, they are going to be going straight back into their life. So sometimes I would suggest maybe if, you know, they like a warm drink or something, they can just stay where they are. Maybe their parent could bring them a snack or something and just have a little bit of downtime after the session to replicate that idea, because often in person, again, you have that leaving, you then might travel home, you've got a bit of processing time, whereas online it is that very abrupt thing. So I would often advise parents maybe that they might just need a little bit of quiet time, or that could be a nice time for them to have a bit of one-to-one with their child. If they, you know, if they have siblings, maybe that's a nice time for just to have a bit of one-to-one time with a parent.
So there's just a couple of questions coming through on the chat now. I think, Megan, somebody asked about the story and how you introduced that, but I think you covered that in the presentation. So unless you had anything else to add to that. There's a question around how it works with older children and young people. So I know that you have worked with teens in similar groups, but yeah, I wondered if you could touch on that a little bit about how that works.
Yeah, I think with older children, so I run a group for teenagers. There's a lot more communication directly with them. So usually they have their own email address, and for them, what's been a positive feedback that I've been getting is that they're in control. So it's something that's just theirs, and they really like that opportunity to use the technology to actually have that control over what they share and what they show. So often the cameras might be off, or they use the chat function to talk to each other, and that's something that seems to come out more in the older groups, that they value that idea of they're in control of the space, and actually they're more in control than they are in person, because they can even choose to just describe their artwork, or to what to share and what not to share, and when to speak.
Right.
Yeah. Yes, I can't really relate, you know, to the question in terms of differences for teens and children, but I can share just briefly, you know, experience of this from working with adults. And what we found in the small pilot in Western Isles was that actually the adults involved, they really, the feeling of being in control in online situation was something that they really highlighted too, and they felt more empowered to really take care of their own health and well-being through this. And I think this was quite evident when some of the participants actually decided to continue with creative activities beyond the sessions on their own. So this was something which they would never actually consider before. So I think this actually online situation can, to some people, it can give this feeling of additional control, which might have long-term benefits for people, I guess.
Mm-hmm. Right, thank you. And there's one more question. Just wondering about the managing the discussion online, and how it can be difficult not to interrupt and chat over the top and have lots of, and just whether you had a system for that, Megan, in the group that you did, or the groups that you do.
Yeah, I think really for me it's about making sure that everyone has a chance. So at the beginning of the sessions, you know, we make a group agreement, and one of the things that is in there is that we try not to speak over each other. Sometimes it's hard because there's a delay in the audio, so sometimes someone's speaking and you don't realize they've spoken yet. But I think that's where, compared to in person, I'm a bit more directive. So I might say, okay, it's going to be your turn to speak next, and now it's going to be, so if someone's wanting to do something, right, okay, you'll go after so and so, but at the minute we're listening to this person, or we're looking at their artwork. So it is a bit more about managing that, which I think is different from how you would work in person. Otherwise it can end up quite muddy with everyone talking over the top and no one really gets their chance. Yeah, so that is being a little bit more directive than I would normally be.
Great, thank you. Anya, do you have anything you wanted to add to that?
Yeah, I guess just only maybe to echo what you were saying, Megan, about the directiveness and perhaps this additional need for therapists to really think things through, perhaps even more so than in face-to-face therapy. Just imagining, you know, those situations that might appear. Perhaps the more directiveness and building rules as you would normally have for group work anyway, but this is especially important in online space. I also found from what therapists shared with me. So yes, so I think this is something that perhaps providers and organizations like yourself as well, I guess, need to be aware of in terms of building more time for therapists to really properly prepare for such sessions to really ensure they are safe. But also what I maybe wanted to share very briefly as well was experience of one of the therapists working on the pilot study. And she had shared that actually the little disturbances that had been happening in the client's home, like, you know, dog barking or partner suddenly coming into the room, you know, things that you don't really want to have, you know, in a therapy space. But she shared in this project that initially, you know, these were things that obviously she considered as obstructing the therapy process, but she learned pretty quickly to really turn them into the benefit, and actually to potentially use them as those little moments in which rapport could be built with the client, and sometimes the glimpses into personal life. I think this is really so challenging as well in online therapy, that you get those glimpses of personal life which you normally wouldn't. You only would if the client chooses to share them with you, while in online spaces they just happen. And I think it's really important that the therapists need to be so sensitive to those, and there's a potential to turn them into therapeutic moments, but there is also they might also be challenging and disturbing for therapy process. So I just feel that delivering therapy online is really such a skillful thing to do from art therapists, and just wanted to highlight this, you know, that I'm just totally impressed by the work you're doing, Megan, and other therapists working online. I think it really depends a lot of skill and sensitivity.
Thank you. Just a couple of last questions. I mean, sort of linked to that is around, you know, what is there a need to expand what the art therapy courses are they covered? Is working online part of what your part of your training basically, and is that something that needs to change? I'm just wondering if either of you know or have thoughts on that.
It wasn't covered when I was studying. I graduated in 2019, so quite recently, but before the pandemic, so maybe things have changed now. But I think it would be really valuable, because in a way just building confidence for jumping into this, and that it is okay, and it usually works out quite well. And I think just because it's something that we've not been trained for at all, it can be quite frightening to do that.
Yes, I think really from the survey, in 2020. So it's been a while since then. It would be really helpful to to find out what art therapists feel now after having had a chance to practice online for a couple of years. Their experiences from 2020 were very fresh. But I really feel from what they had shared that they were really brilliant in so rapidly adjusting their practice without much guidance. And at this time, I feel that there was a common feeling that more guidance would be really needed. It was not maybe something built into art therapy programs, but I think it more increasingly is. Well, I at least know that that in Teesside University there will be a module on online art therapy, which I was invited to join as a tutor. So there are those initiatives, I think, going on, and more awareness of training. But I was really quite inspired how art therapists adapted, their own practice just based on, I guess, some ad hoc, solutions at this time, like really speaking with peer therapists, with their supervisors. I think supervision was something that they had highlighted was really important at this time. But right now, after several years of online practice, I think we can count more and more on more formal guidance and formal training that's been slowly, I think, developed.
Brilliant. There's just a couple of people in the chat have said that they have just come to the end of their art therapy masters, and all of their personal therapy was online. And I suppose that's something else that has changed quite a lot, is the fact that over COVID, obviously, the learning and education was online as well. So it was a different experience. And then Vicky has mentioned that she's training at Brunel. We do have a focus on art therapy in the post-human world. It's very important in this changing world. So we've still got a bit of time. So if you don't mind, I'm going to ask another question that's come in around just the use of art materials with online group versus in-person group, and how you encourage that, and the sort of differences you find when using art materials when you're with someone versus online, and whether there's anything helpful there to think about.
I think one of the things that I've noticed is that they're less inclined to make a mess because you're in your own home, and there's not that feeling of freedom. It does seem a little bit more confined. It tends to be the dry materials, pens, pencils, paint, but in quite a controlled way. And I think that just comes from being at home, and you're sitting at a kitchen table or at your mum's desk or something, and whether you feel like you can just let go and create a mess and do things. So often it is a bit more controlled, a bit more confined to the page. Also, not being able to see the artwork often as it's being made. So I usually ask to see things every now and then so I just get glimpses as things are made, because you do miss the action. You can see if someone's moving a lot, if someone's being very controlled, but you don't get that actual eyes on the artwork as it's being made until the point where they hold it up and show you. Yeah.
Yes, I think you've touched on such an important thing, Megan. Something that I would really love to find a solution to, or I don't know, at least research some solutions. I was actually considering an option of installing additional cameras, for therapists to see. This is obviously very tedious and quite disturbing personal space for participants and clients. But I think the difference of online art therapy, of not seeing the artwork being created, or not at least as frequently as something that really changes the dynamic for the therapist and the client, and something very specific that therapists need to be mindful mindful of. However, it also comes back to this being in control, and I think this is quite an important aspect as well, that it gives this opportunity for the client to actually be in control of this moment that they actually want to share in terms of where the artwork is at this particular point. So I feel, you know, this has lots of challenges. This requires a very different approach, I think, from a therapist. Potentially, it has some advantages in you know, in giving the client more control on how they want their therapy to develop. But it's a very very complex subject. Also, in the pilot that I conducted, we were really fortunate to be able to have the resources to buy art materials, which were sent as art packs to our clients who participated in the pilot. So obviously, this is something to be mindful of, that if a therapy happens in a personal space, you know, that's just not an obvious thing that people would have access to art materials, and this might obviously increase costs either for them or for therapists or organization who provides therapy.
Great, thank you. And I just wanted to pick up on something you mentioned as well about, I think it was around the review that you did, Anya, around the use of other technology within art therapy online. So, for example, I know Megan uses whiteboards, so it's something that everybody is contributing to, and I think your research touched on that, and that possibly we don't know what's coming yet, I suppose, either in terms of other things. I wondered if you could comment on that.
Yes, sure. There's, you know, there's some evidence in research of art therapists trying to work with software developers to develop, you know, even software which would be more suitable to art therapy use than things which had been developed for I don't know, for digital graphics and things like this, which tend to be used currently, because there's nothing better, there's nothing more suitable for art therapy practice. And also, you know, there have been attempts in the US from quite a while ago, from about 20 years ago, actually, or probably even before then, when a specific software was tried in a group setting. So you know, there has been thinking about this for a while, but here we are 20-something years after those initial, you know, documented evidence of this activity, and we still don't have software specific to art therapy. And I think this is something which really should move on, and also give, you know, also because there are other new technologies that come into art therapy world, and this is virtual reality. This is the use of generative artificial intelligence as well. So there are really new technologies that I think we should be aware of in addition to working online. So they can obviously go in tandem and being utilized while working online, but they can also be utilized in a physical space. So yes, so I think that there is lots going on and lots of changes ahead. And I think we should all brace for it and just stay perhaps as informed as we can, you know, to make sure that those changes are positive for practice rather than, you know, disturbing the practice that's happening.
Brilliant, thank you. So we've just finished a couple of minutes early, but I just want to say thank you so much for sharing that. And you both happy if anyone would like to get in touch to, you know, either ask about what's happening with the groups or with anything that you touched on in your research, that would be amazing. We will send on links, and we'll send on the presentations and the recording of this so people have it to reflect back on, because I certainly think there was a lot in there, so I'm sure people will maybe want to re-watch it again. I just wanted to highlight a couple of things. There is a session this afternoon which Dr. Patricia Watt is running, which is also around an online project, Megan, that you are also involved in, which is around working with GI patients, and it focuses also around that supporting families and children at the same time. So again, that was digital work. So if people are particularly interested, that session this afternoon might also be of relevance. And it was just when you touched on VR, we, as part of the Teapot Trust Garden, moving up to Glasgow Children's Hospital, we've created a virtual reality version of the garden that was down to be used in the hospital, and is working with one of our art therapists there, who has particular interest and experience with VR work. So if anybody's particularly interested in seeing what's happened, that's not part of the conference, but again, happy for people to get in touch with me if they would like more information. So we're just going to finish for lunch. We are due back at 1:45. So I'd just like to finish this half of the day by saying thanks again to all the speakers this morning. It's been a fantastic session. So thanks again.
Thank you all.